There's a number of factors that are starting to influence the change process or the transformation process in healthcare. If you look at what's happening in the industry today, obviously the commitment to payment or reimbursement around the quality of services versus the number of individuals you see is one of the major factors that's going to force change or transformation within the industry. The second one, I think, is as you look at organizations starting to come together in an accountable care organization or an ACO framework and going at risk, meaning they're really taking on the risk of managing the health care of the individual as both the provider and the payer. And when you undertake risk, the focus is going to be on let's keep the individual much healthier so that they hopefully never become a patient because I make more money then. And I think the third one is the whole mergers and acquisition process that's taking place today within the industry, where you look at, there's roughly 5,400 hospitals in the future. I think a number of industry pundits, including me, sees that number being in the 500 range within 10 years. Cybersecurity obviously is a huge initiative that is being undertaken in the United States. The challenge within healthcare and why I think healthcare will be targeted is if you look at the value of some hacker gaining access to your Social Security number, the black market value for that might be 50 cents or $1. Same thing with your credit card number. It might be 50 cents or $1. There's been research conducted that says the value of your electronic medical record to a hacker for resale purposes is in excess of $50. So obviously if you're a hacker, you're going to target this industry, which makes the industry's challenge super complex from the standpoint of how do I understand that that's going to happen, and how do I commit the kind of dollars that are required to ensure that we secure that information. And secondly, how do I change the process around how we detect, remediate, and change process going forward. The challenge to the industry, and the numbers I've seen, are in the billions of dollars of risk associated with that, from all kinds of legislative, legal kind of issues that will force the industry to really spend more time focusing on it, making a very high strategy. When I talk to CIOs in the industry today and ask, what are your top 3 challenges? Cybersecurity is 1, 2, or 3. It is always in the top 3. So that tells me that we're starting to focus on it, but yet the industry doesn't have all the answers, nor have they committed the significant amounts of money that's going to be required to implement cybersecurity technologies. As a CIO, it's really challenging to prevent a threat or a breach from happening, because the cost associated with the technology to put in place to manage that whole prevention piece of it is a challenge. So I think it's a combination of spending for some well-funded, well-thought-out technologies to help safeguard that, but more importantly, it's important to train your staff, make them aware of the issues, because quite frankly, most cybersecurity or most breaches in general occur within an organization. So training and education are extremely important, and a process in place to detect when something has happened. It's a lot less costly to detect because I can have technologies that monitor logs, that monitor accesses, but wouldn't prevent it. As a former CIO, I had a breach. And the breach was an individual made a copy of a cancer database, which the individual was authorized to do, and turned around and sold it to a competitor, which he wasn't authorized to do. So, the prevention side of that, I could never have stopped unless I had some VDI technology in place that would have allowed no copying or no copying of disk or of information in general. That might have prevented it, but the detection piece was once information got outside the organization, that's when it was detected.